Welcome back. This week we welcome Dr. Sarina Isenberg, who recently received the new Investigator Award for Research Excellence at U of T and is now the current chair in Mixed Methods Palliative Care Research at Bruyere Research Institute in Ottawa. Dr. Isenberg holds a PhD from Johns Hopkins Bloomberg School of Public Health and tells us how an interview with Oxford University was what prompted her to reevaluate her career interests after having done both an undergrad and master's degree in English literature. She tells us about how her hobbies outside of school influenced her career interests, how her focus on HIV and marginalized populations slowly transformed into a passion for palliative care, and her main advice for all postgraduate students. Enjoy. Okay, so welcome, Dr. Sarina Isenberg, onto Behind the Numbers. I'm so excited to have you here.
Thank you. It's great to be here.
So I know, I'll be honest, you have one of the most impressive backgrounds and resumes I've ever seen in terms of where you went to school, your awards, your scholarships, everything. And
Thank you.
a quick note, a lot of our listeners are epi students, and I know when we see such impressive PIs or head honchos in research, it gets a little daunting almost because you wonder, how can I even get there? You just see all these accomplishments. So I'm excited to sort of break down your path and learn the steps along the way of how you got to where you are, as well as what you're doing now.
Yeah, for sure. I mean, my path is not a straight path. So I hope that will give some reassurance to people who are trying to find their way as well.
Yeah, on that note, you started in English Lit. You did your undergrad and your master's in that. So I want to start there and how you sort of got into English literature and how that led to where we are.
Yeah, so I always loved reading growing up, and when I got to university, my plan was actually to do international development studies, which was a major that was available at McGill. It was like a combination of poli-sci history, international relations, and I came from a place of doing HIV/AIDS activism in high school. So I was really keen on doing that kind of work for my studies. And then I took one course called, I think it was called American Literature and Democracy with this professor at McGill named Peter Gibeon. And it was a 25-person seminar, which was really incredible to have in first year, whereas all my other classes were around 500, 600 people. And I just absolutely fell in love with literature. He's a remarkable professor, and I just loved, the opportunity to read the famous works, but then also to critique them and analyze them. And so it felt like such a privilege to be able to study it. And I was quite interested at the time in going on to get a PhD in English literature and eventually becoming a professor in English lit. So that was the path that I was on. So I continued on the side to do HIV/AIDS activism and got involved with a group at McGill called McGill Global AIDS Coalition, which I eventually was the director of. I also was involved with Journalists for Human Rights, where we had a journal that we published, I think it was quarterly, on different human rights issues globally. And so I still did a lot of activism on the side, but my focus was on literature. And I ended up moving into post-colonial literature as my focus, which kind of was a way to merge my interest in marginalized populations with lit. So I was really interested at the time in nationalist movements and how they were represented in literature and how literature influences nationalist movements and vice versa. So I was really on a path leading me towards academia and English lit.
Oh my gosh, wow. So then after your master's, you worked at Deloitte Consulting.
Yes.
So was that kind of what got you into wanting to be more in the health sector for research?
So what happened was towards the end of McGill, I had applied to a number of master's and PhD programs in English literature. And I tell this story a lot, but I had applied for the Rhodes Scholarship to study literature at Oxford. And it was in the interview that the interviewer was looking at my CV and saw all this HIV/AIDS activism I was doing, and then saw that I was applying to literature. And he's like, there's this disconnect in your CV between what you do outside of school and what you're doing in school. And
Mhm.
no one had ever put it to me like that before. So like I had a bit of a crisis of being in that interview. I did not get the Rhodes Scholarship, but it made me start to think about maybe I was on the wrong path. So at that time, I was already, I had already applied to all these master's and PhD programs. I did not get into any of the PhDs, which honestly I'm really happy I didn't, because I might have ended up in a very different place. But
Yeah.
I decided to still do my master's at Queen's. And there was a professor there who studied English literature and HIV/AIDS. And so I figured it was like an opportunity to kind of bridge my interests. Of course, she went on sabbatical the year that I was there. So I didn't really get to work with her, but she hired me as an RA. So I did some research with her. And then she also got me a job with her sister. So the professor at Queen's was Rosemary Jolly. Her sister was Anne Jolly, who is actually faculty in Ottawa, an epidemiologist. So I did some research with Anne on qualitative interviews with individuals who were homeless or marginally housed with current or previous use of injection drugs, who were also living with HIV/AIDS, to try and understand their access to primary care. So when I finished my master's, I went into that job. And I also, in my master's, took a course in health services and policy applications, which was really great. So anyway, I started this research job working in Ottawa, interviewing individuals who were homeless, and really loved it. And then I was still living in Toronto, where I grew up and where I had moved home after Queen's. And I was really trying to find a job in healthcare, because I had this interest in healthcare since like high school, essentially. And no one would hire a person with a master's in literature to do health research, despite, the qualitative experience that I had. So
Yeah.
I went into management consulting because it was an opportunity to do health research. Like I focused on health services at Deloitte. And it really allowed me to get exposure to the healthcare industry in ways that I hadn't had before. So, I did strategic planning for hospitals. I did program evaluations for the Ministry of Health. I did clinical information system implementations for hospitals. I got a wide exposure to healthcare in Ontario. But it was actually, when I was applying for management consulting jobs in Toronto, I was simultaneously applying to masters and PhDs in public health. So I already knew what I wanted to do. Like my intention was always to go back to school and specialize. So I started at Deloitte in January of 2013. In March of 2013, I got into a bunch of public health schools. So I got into I got into the PhD program at Dallana at U of T. I got into the PhD at Hopkins. I got into the master's at Columbia, master's at Emory, and also a PhD in English literature at Edinburgh that I just kind of threw in to see what would happen. And so I had a hard decision ahead of me. And I also, had only been working for 2-3 months, and I wasn't ready to quit. So what I did was after lots of thinking, I decided that I wanted to go to Hopkins, and I asked them to defer for a year, which they allowed me to do. So that allowed me to continue to work in consulting, save money, and then go to Hopkins.
Yeah. Oh my gosh. Okay, so first, I love that. I mean, for anyone who is a sports reference person, almost like a Michael Jordan moment where he didn't make his grade 9 team and then went on to be a star. Like you didn't get into those PhDs initially, and then you get into Johns Hopkins, which is like one of the best public health schools in the world. And then you said it took some time to think. So, I mean, you'd think, oh, Johns Hopkins said yes, like I'm going 100%, but you had some time to think about it. Like what was going on in your head when you get these yeses from these big schools? And I mean, you have to move to the States. Are you like, how did that process go?
So the decision making, it really felt, there were 3 options. So what was the the 3 options that I was seriously considering? So I figured if I got into the PhDs in public health, I wasn't going to go do a master's. Like it just didn't make sense.
Yeah.
So do all the master's programs in public health were out. And so the decision came between the PhD in public health at Hopkins, the PhD in public health at U of T, And I was on the waiting list for the American Studies program at Yale. There was a professor who I was like absolutely obsessed with named Wai-Chi Dimmock at Yale that I really, really wanted to work with. And she was like my academic crush. And so it was to work with her. I think honestly, had I gone into Yale, I might have accepted, but I didn't. So in choosing between U of T and Hopkins, it was difficult because like U of T had a much better funding package that they were offering me at the time. And there were also way more scholarships that I could apply for as a Canadian studying in Canada. My now husband, then boyfriend at the time, lived in Toronto. My whole family was in Toronto. All my friends are in Toronto. I had a life in Toronto that I wanted to live. So that was definitely pulling me towards U of T. Also, U of T is an excellent program.
Yep.
Hopkins was a risk. Like at the time, they weren't offering me a tuition scholarship. So it was like 25% of tuition coverage for the first 3 years, and then like 75% of tuition coverage for the last 2 years. And tuition was like 40 to 50,000 American a year.
Yeah.
And I didn't have that kind of money. I'd been a management consultant for like a year and 7 months. And so I had some stuff saved, but there's also there's very limited scholarships for Canadian studying in the US. So Hopkins was a big risk. And I talked to a lot of my mentors about what I should do. And, Hopkins would open doors that U of T couldn't. And I just figured, I was 24 at the time. I felt like I was still young. I could still like take these risks, do these opportunities. Like my boyfriend and I weren't particularly serious, so I wasn't too concerned if we broke up. Like, I was ready to take the leap. So I chose to do Hopkins. And then I applied for CIHR and the what's it called, Fulbright Scholarship, and the Organization for American States. And I ended up getting a full tuition scholarship from Hopkins, and I got the Organization of American States Award. So I had funding.
Yeah. So you were the only Canadian to get that one. I saw that.
Yes, that is true. The only Canadian to get this obscure scholarship. But yeah, it was pretty cool.
Yeah. And do you think it was that extra year of deferral that sort of helped all this line up?
So I think the extra year of deferral actually convinced Hopkins to give me the full tuition scholarship, because I said to them, look, I've applied for the awards I'm eligible for. I have gotten one of them, but it's still not enough. I took a year to try and save more money. And so they obliged. I don't think the year deferral necessarily helped with the scholarships in any way.
Okay. And how was studying there? Like, what is it like at Hopkins? That's for my personal interest. I'm curious, you hear of these big names, big schools. What was it like being there and in it?
So I really thrived in that environment. It's hyper competitive. It can be at times cutthroat. You really need to find the right people to work with. And it's the type of place where you make your opportunities. And so I sought out mentors and professors to work with. I worked a ton of research assistantships while I was there. I also was a TA. So I did a bunch of things to make money, but it was a fascinating place to be. Like, there's incredible world leaders coming in all the time to give lectures. Your professors are famous and are really achieved, and the students are super impressive. Like, one of my best friends from Hopkins is from Nigeria, lived in China and now lives in London, and we stay in touch. And I have friends now all over the world from Hopkins who have just done incredible work. So it was a really special place to be. Baltimore is a tough city. There's a lot of crime in Baltimore, a lot of poverty, a lot of social economic disparity. So it makes it tough to live there. But the school itself, there were things I hated about it when I was there, but ultimately I think I really benefited from going to Hopkins.
And while you were there, did you continue specifically on HIV/AIDS and that interest? Or I know now you work more in palliative care. Did that develop while you were at Hopkins?
So the palliative care interest actually developed when I was in management consulting. I was doing a project for the Ontario government, and one of the outcomes or deliverables was a report on the future of palliative care in Canada. And that was my first real exposure to palliative care. My grandfather and uncle had actually received palliative care at the end of life, so I had some like personal experience with it, but I didn't really think of palliative care from a system perspective until that project. And then when I applied to Hopkins, it was to work with a well-known HIV/AIDS researcher. And just coincidentally, right when I was applying, she had just gotten a grant to do palliative care and HIV research. And I thought, oh, this is great. I've just been exposed to palliative care. I'm super interested in doing it. So I'll work with her. This is a perfect fit. So when I got to Hopkins, I was working with her in my first year. And I, through her, got introduced to a number of palliative care researchers and just felt that I was more drawn towards the palliative care field, and also just the researchers in palliative care, just it was a better personality fit than with the professor who focused on HIV and palliative care. So I just slowly transitioned over to palliative care more generally, and have continued to work in palliative care now for marginalized populations and non-cancer populations. But currently I'm not doing any HIV research.
It's nice to see how no matter what stage you're in, there's always room to figure out your interests. I think that can sometimes be a scary thing, even of going into choosing your master's. You wonder, is this going to be the last topic I get to work in and have to stay in forever? Or even your PhD, you went in going for specifically HIV and AIDS and then moved into palliative care. It's nice to see that there's still the opportunities to tweak and fine tune what you're interested in, and you're not necessarily stuck.
Yeah, definitely. And I think, things are never set in stone. You can always, modify your opportunities. And, at Hopkins, I actually switched advisors after my first year, which was quite a big deal. Not really heard of to switch advisors. And so that was very stressful, but I'm ultimately very happy I made that decision. And to this day, I'm very close with my dissertation advisor, who was sort of like a surrogate mom to me. So yeah, I think it's important to always keep your options open and try to explore things outside of your comfort zone, leaving Canada and leaving my family and going somewhere where I literally knew one person who was a second cousin that I had never met was scary, but I'm so happy I made that choice.
So I'm guessing it was an easy decision then to make to come back home to Canada and to Toronto.
Yeah, so I always knew I was coming back to Canada. So for a couple of reasons, beyond the obvious of, my boyfriend was in Canada, my family was there, my friends were there. For me, it's important to do health research where I can have the most impact. And the healthcare system in Ontario is just way more amenable to change. And there's a lot more I can do in palliative care in Ontario than I could do in the States. I also just, I believe very strongly in universal healthcare, and it was very hard existing in a healthcare system that doesn't abide by those principles. And I also, I was, not to get too political, but I was in the US when Trump got elected and just kind of decided it wasn't the political environment that I wanted to be living in. So yeah, coming home was a no-brainer for me. It was just, I had to find a job, which was challenging.
And then you got into, did it take a while? Because you became an assistant professor at U of T and you're a scientist with Sinai Health Science. Coming back, was it difficult because you had done your PhD elsewhere? I mean, you'd think benefits, you went to Hopkins, so that's getting you in. That's a good name to have. but did you miss out on potential like networking by being out of the country? Because that's also another thing I've heard of, people being nervous of leaving and coming back. You miss out on potentially that, the networking.
Oh, totally. So what I did was every time I came back to Toronto, I had informational meetings with people involved in palliative care across the province. So I think I had something like 50 informational meetings with people to understand what opportunities might exist. And so I was constantly networking and relationship building and going out of my way to have collaborators in Canada. So when at the beginning of my third year of my PhD, I got connected to Russell Goldman, who's the head of the Tummy Latner Center for Palliative Care at Sinai Health. And I was talking to him about opportunities in palliative care and how I wanted to have a research career. And we sort of got to talking about creating a position for me at Sinai. So that was in September. And so they wanted me to start as soon as I could. So that kind of motivated me to finish my PhD faster. So there were other places I was talking to beyond Sinai about opportunities. But Sinai was definitely the most serious opportunity. And then I finished my PhD up in just under the 3 years and defended in June, submitted the final version of my dissertation in July, moved back to Toronto in July, started at Sinai in September.
Oh my gosh, that's a busy few months.
It was really busy. Like the week before I submitted my dissertation, I had my first interview at Sinai. And the week before I defended, I had my final interview. So I was like flying back and forth. Like I really did not spend a lot of time on my defense.
I feel like that almost didn't give you time to stress. You just had so much, you couldn't get nervous for either.
No, I was just like in complete like automaton mode. Yeah.
And then so you were at Sinai and U of T for a few years.
Yep, 3 years.
And then you came to Ottawa to work at Bruyere. How did that, because you just came off a year where at, say, U of T, you got the Early Career New Investigator Award of last year. And so you're building this up. How did you choose to switch?
Yeah, so there were a number of facets. So I really enjoyed my time at Sinai and built amazing relationships in the Toronto palliative care community. But, you know, I had to think about where I wanted to go in my career. And I hired a job coach, which is something that I like highly recommend for people. And, you know, I sat down with her and talked about where I saw myself going and like what my career goals were. And we kind of realized that I need to start looking for other opportunities to achieve what I was looking to achieve. I had already been working a lot with researchers at Bruyere, being co-PI on grants with them, leading projects with them. And it was a really natural progression to move to Bruyere to continue those collaborations. I also was really seeking to get mentorship from senior researchers. And there's just enough, like, there's really a core critical mass of palliative care researchers at Bruyere and in Ottawa. And so it was a great opportunity for me to get to work with them and learn from them. So it was, you know, over the span of, you know, several months to a year that I was talking with Bruyere and talking about the opportunity. But it was definitely, you know, with mixed feelings that I left Sinai. I'm still collaborating with them on many, many projects and hope to for a long time to come.
And you're the chair in mixed methods palliative care at Bruyere.
Yes.
And you do, so the mixed methods is the quantitative and qualitative research. So can you talk a bit more about that and sort of what those two, the benefits that each brings to each other rather than say just doing qualitative research or just doing quantitative?
Sure. So I do a lot of different methods. Some might say too many. So I work with ICS data, working with admin databases, trying to understand access to care across the healthcare system. I do cost effectiveness studies. I've done cost effectiveness analyses of inpatient palliative care consults, palliative care units, end of life home care. I also do qualitative interviews with patients and caregivers and healthcare providers to understand their experiences of palliative care. And I just really love working with both quantitative and qualitative methods. And I think they answer different research questions. On a lot of grants that I've recently put in, some of which have been awarded, they're mixed method studies where we propose to do something with the admin data, but then we, in the grant application, acknowledge there's limitations to what we can do with the admin data. So we're going to leverage qualitative methods to answer some of the questions we can't get at with the quantitative. I really love qualitative. I find it extremely challenging, but I think it provides such a holistic understanding of the patient, caregiver, healthcare provider experience that you just can't get from the quantitative. Not to say qual is better than quant, but qual gets at different things than the quant.
And it probably gives you a more it for sure gives you a more well-rounded view of potential problems and things to work on and how you can go at improving them if you have a more, like you said, holistic view of it rather than just the one or the other.
Yeah, for sure.
And so working with both, you said now there's a few grants that you put in, and during COVID, how has that affected, bringing it back to the pandemic that we're all sitting in?
Yeah.
How has that affected your research or what you're able to do, or has it affected in any way? Has it almost given you more things that you can now look at because it's novel and everyone wants to know how it affects everything?
Mm-hmm. So I would say I am guilty of what I refer to as the COVID pivot that many of us in research have done. So I have been doing COVID research. So back in April, myself and colleagues in Ottawa started putting in a bunch of grants related to COVID and end-of-life care. So two grants that we have right now are looking at end-of-life drug prescribing in long-term care homes before and during COVID. So we don't actually have a way in the admin data to look at access to palliative care and long-term care. So we're using end-of-life drug prescribing as a proxy for receipt of end-of-life care. And so we're doing a quantitative study and qualitative study on that topic. Another project I'm working on, though it's not quite palliative care, is my colleague James Downer developed an ICU triage protocol for COVID. That's will, if necessary, be implemented across Ontario. And so we've developed a surveillance system to assess how successful the protocol is, and also feed data live into it to constantly improve the protocol and the measures that it's enforcing. So there's also a quantitative and qualitative component to that work. Those are my two main COVID projects right now. There's other things that we put in COVID related that unfortunately weren't funded. So COVID's impacted my work in that, I'm doing some more COVID research. A lot of my other research, got slowed down. Like I had projects waiting to be assigned an analyst at ICS, but ICS prioritized COVID projects. So non-COVID projects were put on the back burner. Or, at one point in time, or still REB, research ethic boards were prioritizing COVID projects, so non-COVID projects were heavily delayed. At one point, we weren't allowed to recruit for non-COVID projects, so a lot of things got slowed down. Fortunately for me, most of my work is just sitting in front of a computer, which I can do from anywhere. So I was able to work from home, and nothing was really delayed in that way. So that's been, I count myself very lucky considering what many other people have gone through as a result of the pandemic.
Yep.
But yeah, and I also acknowledge, I don't have children right now. So I haven't had to do the balancing act that many parents are doing right now. And especially, female academics have really been struggling, and there's been a lot of research out about, what they're going through and how their productivity is delayed. So I really feel for those people.
Yeah. Especially it seems, at least the benefit, because everyone's going through it, it seems there is an understanding, a bit more understanding, because it's I mean, everyone's sitting at home. Everyone understands the difficulties of balancing all these things that you may have in your life. So
For sure.
at least understand. I have one last quick question for you, and this is sort of what your major goals in palliative care and end of life care are. Like, what do you hope to, if there is in a sentence or two, what you hope to achieve with everything?
Yeah, so the sentence.
That may be a tough question.
Yeah, it's really tough. So the sentence that I say is like my elevator pitch. So when people ask me what I do, is I assess access to palliative care for marginalized and non-cancer populations, and I test and look at ways to improve the quality of care. So what I would like to do in the long term is I think I'd like to get into the space of designing and testing interventions to provide palliative care to marginalized groups. So one grant we have right now that isn't funded yet, but we're hoping will get funded the next CIHR project round, is looking at access to palliative care for patients with opioid use disorder. So when patients have opioid use disorder and then are ends of life and have pain, it's very complicated to receive pain management treatments. And so it's a really understudied area. So we have the work we plan to do is to look at the quantitative, like admin data understanding of like who is accessing end of life care in this population, a qualitative study understanding the barriers and facilitators to that care. And then after that grant, the next step would be designing an intervention to improve care for that group. I'm also interested in palliative care for heart failure populations, lung disease populations, and we just got a grant on dementia and palliative care. So I can't say I have a singular goal. I mean, what's really important to me is trying to make sure that everyone who needs it has access to palliative care, and that's a pretty lofty goal. I'm not
but an amazing one.
Yeah, but I can't achieve it on my own. I need to work with a team of people to do it. But I'd say that would probably be it. Improve access is the most important to me. I think we have a long way to go in terms of, also improving quality. And we've got, as you may know, there are like workforce shortages in palliative care. There's like huge health human resource capacity issues. There's not enough trained palliative care specialists, not enough people practicing palliative care as generalists. So there's a lot of issues to address. But overall, trying to improve access would be my hope.
Well, it sounds like an amazing goal. And although there are a lot of shortcomings in the system, maybe that makes it more exciting. There's so much opportunity for you guys to fix a lot or to improve a lot. Mm-hmm. So while it's unfortunate that research is never ending in terms of that there are so many problems to fix, it's nice that research is never ending because there's so much for you to work on and to do throughout your career.
Yeah, I don't think we'll run out of things to study in palliative care. And unfortunately, as the demographic of the population ages, we'll just continue to need to ensure more people have access to it.
Wow. Okay. Well, thank you. That was so interesting to hear, how you went through all these decision making in terms of your own career and your path and how you got to where you are. And I love that it continued to change throughout, which was settling for the students like me who are constantly thinking of, oh my gosh, is every decision going to make my entire life? And so that was really nice to see that everything you did sort of complemented in one way or another what you finally ended up doing.
Yeah, and one piece of advice I would give to students currently studying masters or PhDs in epi and public health is not to put so much stress on yourself to find the perfect thesis or dissertation project. The mantra that I had going through my PhD was a good dissertation is a done dissertation. And one of my mentors at Hopkins said to me, your dissertation project is like a practical project that you can achieve. Like your pet projects, your favorite projects are what you do outside of your PhD. And, my PhD was a very interesting topic on advanced care planning decision aids and like the role of family members in post-surgical or pre-surgical visits. I loved the work. But it's not my main, that work is not my main focus now. And, what I'm doing now is actually way more tied to what I did outside of my dissertation. So, a lot of students spend, I think, too much time trying to find that perfect project. And I think it's better just to choose something and to move forward with it.
Wow, that was a very great piece of advice. Thank you. Even for me, whether anyone else finds comfort in it, I definitely did.
Okay, well, I'm happy to hear that. That's great.
Thank you very much for coming on, though. This was such a pleasure to have you on and to hear about your path and your story and all your research.
Yeah, great chatting with you. Thanks so much for the opportunity.
Thank you.
Okay.
Have a nice day.
You too. Bye-bye.
Bye. Thanks for listening. This chat with Dr. Isenberg was fantastic for pointing out that no matter how windy your path is, everything does end up working out. And as long as you follow your passions and interests, you'll find opportunities that you're passionate about. I hope you enjoyed this episode, and if you have a moment, we would really appreciate if you could rate, review, leave us your thoughts and comments. We love hearing what you have to say, and on that note, have a great Monday, and see you all next week.